Welcome to the ER Physician Show. I'm your host, Dr. Elliot Brown. Before we get started, I want to tell you a little bit about the ground rules. It's going to be just like making rounds with me. I trained in a rigorous program at St. Luke's Hospital in New York City, and I apply the same principles when teaching my students in the cardiac care unit. Number one, you're going to be honest. You're not going to fudge any results. If you make a decision to give an aspirin for a heart attack, you're going to tell me which trial showed that improved the mortality rate, so that you always know what you're doing on an evidence-based medicine basis. And the final thing is that you're going to treat human beings with dignity and respect. Anybody who trains under me that doesn't know how to treat a human being properly doesn't get past me. That is not negotiable, and that's a deal breaker. And finally, when you make a medical decision, I want to know where you got it from. We practice evidence-based medicine. You're going to give somebody an aspirin for a heart attack? I want to know what trial said that it reduced mortality rates by 18 to 20%. I don't practice medicine by hunch. So we're going to apply these principles to some fascinating cases together. Come on. Emergency medicine definitely has its pros and cons. You know, there's perhaps nothing more exciting than the intimacy of meeting this complete stranger in the throes of a critical, acute disease that you need to think on your feet, get a quick history, make a quick diagnosis, and do something quickly in order to get them out of the woods. That's what we live for. That is the most exciting part of being an emergency room physician, or any physician that treats acute medical emergencies or surgical emergencies. But it also comes with a cost. You know, once you get that excitement and you put your finger in the dike in the emergency room in someone's terrible illness, they're not your patient. You lose them to follow-up. You don't see the whole continuity of an entire illness. So on that level, you sort of do miss a little bit of the patient contact. In addition, emergency rooms, unfortunately, are often used by people as a doctor visit when they don't have their own doctor. And while they may think what's going on is an emergency, it's far from it. So that the real acute, exciting emergencies can kind of be few and far between. But overall, it's an extremely exciting place to work and one of my favorite places in the entire hospital. Just the opposite. I train my students and my residents that if you can't feel the patient, you're not going to be a damn bit of good as a physician. This is not about just prescribing some blood pressure pills or an antibiotic. You need to sort of talk to the patient and understand them and hear them. Hear where they're coming from, hear where they're going, and how they got to this point in their life and in their health. The heart attack doesn't start the day the patient gets to the emergency room. So as far as I'm concerned, you need to feel your patient, and if they don't make it, then you need to be there with the family to help them grieve and to help people that are available and in need. I teach 2 months in the CCU in Paterson in New Jersey with medicine students, residents, interns, and the nurses make rounds with us as well. I would say it's probably one of their favorite months all year. I show up every day with a new lecture and a new little talk about a disease, a nuance, something in cardiology that teaches these kids the real science of it. We make bedside rounds. We go and evaluate the patients together so that they become comfortable evaluating an acutely ill person with chest pain and unstable vital signs. But more than that, as a leader, I know it's important to let your players dance to the beat of their own drum. If you're going to get the most out of your team, you've got to appreciate their little differences. And medicine is an art. So as long as something's being done with good, evidence-based medicine, I know there's more than one way to skin a cat. I give them some leeway. They can order the tests in the order that they want. They can order the antibiotic they're comfortable with if I know that it's appropriate. And that's how you see these kids learn and become true individual physicians in their own right. That's some great stuff. You know, we did have one real problem last year. I had a pretty good team in the CCU, and they were very bright. I had one resident who was a real problem. The resident's job is to teach the interns who are below them and kind of manage the unit with the help of me. But part of managing the unit is knowing how to integrate with the nurses, how to tell a nurse, this is today's plan, the potassium is low, we're giving this, we ordered a CAT scan. Unfortunately, he was so arrogant that he had his own agenda. And while the entire unit was trying to be cohesive and take care of the sickest people first and get everything done properly, this guy would always buck the system. I loved him personally. When we made work rounds, he was brilliant. He could cite the literature with the best of them. But at the end of the day, we dropped him from the program because this guy did things that put patients' health at risk. He disrespected seasoned nurses who knew how to take care of an entire unit and were trying to help him manage the place. And he was warned, and he was warned, and we let him go. So if you are not going to treat your fellow patients, employees, human beings with respect, you're not making it when you come to my chart rack to make rounds. I'm perfect for this show. Number one, you need a leader. Someone's going to sit and be the host of a show and interview people. You want someone who's led. President of this, chief resident of that, chief fellow here, chief of cardiology there. That's me. You want someone knowledgeable. I know the literature with the best of them. I'm board certified in internal medicine, cardiovascular disease, and nuclear cardiology. I teach 2 months out of the year. I'm active in academics. I know how to train students and residents and interns. And I know how to interact with nurses and treat other people with dignity. And what's more, I love this stuff. I'm passionate about helping people through their problems as well as their medical problems and how the two of them come together. That's fascinating. And that's what people want to see, that human side of the science of medicine. So here you got a guy who brings the knowledge of the literature, the leadership qualities, and somebody who can listen to music, avid sports fan, talk politics, and go high-five the guys in Central Supply as easy as he can sit down in the doctor's lounge and present a case. This is Dr. Elliot Brown, and I'm your host. Well, that's all the time we have tonight, folks. I hope you enjoyed watching. This is Dr. Elliot Brown saying be real and be well.